Mr. President, the Hippocratic Oath that guides healthcare practitioners begins with these powerful words: first, do no harm. This is certainly good guidance for our doctors and other healthcare practitioners, but isn't it good guidance also for those who are in the realm of healthcare policy, those who are healthcare policy practitioners, as well as the doctors themselves? First, do no harm. But those powerful first words of the Hippocratic Oath, very relevant to this discussion, are being ignored by my colleagues across the aisle, by the Republicans, who have come to power and said, we are going to dismantle health care across this nation for millions of Americans, and we don't know what we're going to do next. We're going to repeal this plan, and we're going to run away, and in a few years, we might figure out how to replace these health care provisions. This is an irresponsible perspective. We hold in our hands the health care challenges of America, and to repeal and run will do a tremendous amount of harm. And the irresponsibility of it is terrifying families across America. They're scared of what the future holds, of the uncertainty that awaits them under this strategy of making America sick again. Folks are afraid that if they've ever been sick or injured, they'll soon be denied coverage because they have a pre-existing condition. They're afraid that they might be one of the more than 20 million Americans who will lose insurance, who gained insurance through the ACA, gained access to affordable, quality health care. They're afraid that the chaos created in the market will result in premium hikes that will make health care unaffordable to low-income and middle-income Americans. They're afraid of an unforeseen emergency, wiping them out financially, driving them into bankruptcy. And our seniors, they're afraid as well. They remember the situation that existed before they reached 65, where if they had a health care need and didn't have insurance, they had to wrestle between paying for their prescriptions or paying their heating bill. And they don't want to be in that position again. They know how much progress we've made by filling the donut hole that pays for prescriptions throughout the continuum. And they don't want us to go backward. So from so many different directions, Americans are terrified with the Republican repeal and run strategy threatening to do harm to their lives. And how do I know this? I know this because they are writing to me, and they are writing to my colleagues, and we're sharing those stories tonight. The letter I have from a young woman in Portland starts out, I must implore you to protect the ACA. Its existence saves the lives of millions, including mine. She says, I was born in full renal failure. I currently maintain stage 3 renal function with the help of prescription medication. If I am unable to afford my medication, I'll enter end-stage renal function, that is kidney failure, and I will die. She ended her message by saying, I am so scared. I am only 26. I have so much more to do. Cameron of Beaver Creek writes, my wife and daughter both have chronic health conditions, and the ACA has allowed us to have them covered by health insurance despite having pre-existing conditions. If the ACA is repealed, we will lose this protection, and I don't know how we could afford to pay for their medical costs directly. And Lisa in Wilsonville wrote to me about the impact that repealing the ACA will have on her special needs daughter. Lisa says, if the ACA is repealed, we lose funding that directly impacts my daughter's programs, her respite care, her Medicaid, and I will no longer get support and be able to take care of my daughter. Just before Christmas, I got a message from Nick. Nick wrote to share the story of a recent medical emergency that threatened his life, he said, "Without notice, this past March, my heart suffered a debilitating viral infection, which resulted in congestive heart failure. As things stand, I require a new heart and await that occurrence with patience and resolve." He continues, "Thanks to the ACA, I was able to purchase health insurance the month prior to that diagnosis. Without it, I don't know how I could have paid for my initial 3-week hospitalization. Without it, my ability to obtain a replacement organ would be uncertain. Without it, I envision a bankruptcy filing as the only viable financial option." Individuals are writing about their challenges as patients, but doctors are also writing to share their observations as folks who see hundreds of patients in the course of a year. Meg writes and says, "I've practiced both before and after the Affordable Care Act and witnessed the sense of hope and relief the expansion of Medicaid in Oregon brought to my patients who are facing serious illnesses. We've been able to participate in community and state-level innovations to help transform healthcare delivery, lowering costs, improving outcomes, and making people's lives better." Isn't that what we should be about? Not a strategy of doing harm to millions of Americans, but a strategy of making people's lives better. A physician from Roseburg, a hand surgeon, wrote about the challenges that he and his wife face, the serious medical challenges, and says, "Prior to the Affordable Care Act, we were uninsurable due to these pre-existing conditions. It seems clear the ACA will be repealed, and we, among millions of other Americans, will again be uninsurable. This will not be simply a matter of the insurance being expensive. It will be a matter of the insurance not being available at any cost." And he continues, "So I am pleading with you to enact legislation prohibiting insurance from denying the ability to sell policies to individuals with prior medical conditions. The health of millions of Americans rests on your shoulders." And I might add that the health of millions of Americans rests on the debate and the discussion and the decisions of the U.S. Senate. And Angela, another doctor, wrote about her work with the LGBTQ community, saying, "The loss of the Affordable Care Act would be devastating. We have only just won the right for patients to access medical care, hormones, and surgery in this last year. I've seen a great improvement in my patients' well-being and mental health. With the loss of the Affordable Care Act, many of my patients will be devastated." And she continues, "There is a 50% suicide rate in the transgender community. Please help me prevent any further suicides by protecting the Affordable Care Act." Message after message after message saying, first, do no harm. And that means we as a body need to come together and move away from this reckless repeal and run strategy being proposed by the Republicans. People are writing to express their fears and frustrations, and they're calling on us to do the right thing. Folks like Meg and Nick and Cameron and Lisa and Douglas, their lives are better because we enacted the Affordable Care Act. These folks are writing because they are among the millions of people who are affected by the changes in this law, the millions who gained insurance coverage because of the law, or they are among those who gained coverage because of the expansion of Medicaid, or they gained coverage because tax credits made health care affordable to low and middle income families, or they are among the 27% of Americans living with pre-existing conditions who couldn't get insurance on the private market, or they are among those who lost coverage because of annual and lifetime limits before the ACA. These stories are powerful because these individuals are on the front line, and health care is essential to quality of life not just in America, but in any location on this globe. There is enormous stress connected with a faulty health care system. And what we've achieved with the Affordable Care Act is peace of mind for millions of Americans, peace of mind that there will be the care in place when they need it, that they'll be able to afford it and they won't be bankrupt. Their loved ones will be able to have their health care challenges addressed. Folks used to come to my town halls and say, Senator, I'm just trying to stay alive till I reach 65 because I have a pre-existing condition and I can't get medical care. Can you imagine the stress that's involved in that? And folks would come and say, I would love to get insurance and address the health care issues I have, but I can't because I can't afford it. And now they can afford it because of the subsidies, the tax credits provided through the ACA. There was a woman who came up to me at an MS, multiple sclerosis, fundraising march, and she said, Senator, things are so different this year. And I said, what do you mean? What has changed? She said, a year ago here in the MS community, if you got a diagnosis and you didn't have insurance, you weren't going to be able to get insurance because you had a pre-existing condition. She said, and if you did have insurance, it's a mysterious and expensive disease, and because of annual limits or lifetime limits, you'd probably run out of health care. She says, now we have the peace of mind to know our loved ones will get the care they need. That's what we're fighting for. To first, do no harm. And second, make life better for millions of Americans. Let's come together and defend these massive advances that we've achieved over the last few years and not destroy it in this reckless, irresponsible repeal and run strategy. Thank you, Mr. President.